Well, a new study from the Department of Health was released today about the role of medical cannabis for chronic pain in reducing prescription opioid dosages. Joining us now is Dr. Laszlo Meckler, who is the medical director at Dent Neurological Institute. Doctor, thanks for joining us tonight.
Thank you.
Doctor, let me ask you, the headline coming out of this study is patients who get 30 days or more of medical cannabis for chronic pain, they see a 51% drop in prescription opioid doses. What's your reaction to that finding?
Well, I think this is a finding that we've seen over the last decade. In fact, we have at the Dent Institute 13,000 patients, and we have published multiple abstracts and articles, which interestingly comes with the same statistics, which is about 47 to 51% of patients who use cannabis will decrease the amount of opioid or narcotics they use for various reasons. In fact, people who are on opioids come to us saying, I want to get off opioids. Could you help me? So this finding just reinforces what we've known for not just years, but decades.
So how does this study in particular impact the future of medical cannabis? Will we see an increase in usage among healthcare providers?
Well, I think this just adds to the total amount of articles that are being written. Remember, for many, many years, 92% of articles have always been looking at the negativity of marijuana or cannabis. Now articles are coming out looking at the positivity, how it helps health. So I think for physicians in the community, I think this is just an added information. But I have to emphasize this study that was done through the city of University of New York was not a randomized study. So still we have to go and do proactive randomized studies looking at cannabis, which then will be accepted by the medical community. But unfortunately, as we all know, cannabis is a federally illegal drug. And for this reason, it's very difficult to do research.
Yeah, and what do you think that this study does for the opioid epidemic that the country is still having? Do you think that this will maybe inspire more research into medical cannabis as a possible solution for patients needing long-term opioid treatment?
I think it raises the information about the fact that there is another option. In fact, there are other studies that have shown that about 30 to 40% of people who use medical marijuana use it for pain. So I think this information is not only important for the medical doctors, but also for patients. And when patients are very fearful of the use of opioids, and with the tremendous increase in the deaths from fentanyl and other opioids in the United States over the last 3 years, it has doubled and is getting to the point when we triple the amount of deaths in the United States. We're talking about over 100,000 people dying from opioid overdose. So this may be a way for patients and doctors to decrease the amount of opioids in patients who are prescribed opioids, such as cancer patients and patients from trauma and spine disease.
Doctor, final question. The majority of your prescriptions that you write are basically for what ailment that people have?
Well, as I looked at my statistics, of the 13,000 patients, 75% are being prescribed for pain. But when I look at the pain, many of these patients have not only traumatic injury or cancer, many of them have pain related to multiple sclerosis, Parkinson's disease, and spine injuries. So there's a long list of reasons why people are being prescribed opioids, some of them truly beneficial, like in patients with cancer. But adding an opioid to it may decrease the total amount of narcotics being used for the treatment of pain. And I think that's a good thing, because opioids not only cause the potential for death, but also mental issues, depression, constipation, disorientation. So opioids have a long list of side effects that medical marijuana may help out. And I think that's the benefit of this study.
Dr. Laszlo Meckler, Medical Director at Dent Neurological Institute, one of the best in the business. Doctor, thank you for joining us tonight. We really appreciate your time.
I appreciate it. Thank you very much.
Thank you.